Hello, everyone. Thank you so much for joining us. We're going to go ahead and get started. I just want to remind everyone we are recording. So if you want to stay on camera, you're more than welcome to, or you can stay off camera. That's fine as well. My name is Tamuri Richardson, and I am a certified mental health advocate and a speaker presenter for NAMI San Francisco. I'm also the chair of the NAMI San Francisco Black Mental Health Committee as well. I want to thank you so much for being here tonight. It is an absolute honor to be moderating NAMI San Francisco's first Black Mental Health Summit. And I want to make sure that I thank the executives, Natasha Levine and Ann Fisher, who not only supported this effort, but understood the importance of us having this conversation in all communities, but most importantly, my community, the Black community. So I want to thank them for that as well. I do want to have a couple of housekeeping rules and just a few things for you as we proceed. We have a wonderful conversation that's going to be started here tonight with two wonderful panelists. So I want to make sure, again, if you are comfortable having your camera on, by all means, this is a recorded session. If not, feel free to rename yourself. You can put questions and comments in the comment box, or by all means, Tamuri Richardson, of course, again, is my name. You can personally comment questions to me to ask to the panel, and I will anonymously do so, not telling anyone your identity. So please continue to do that. Also, please chat with each other. Some of you may not know each other, but sometimes that can be very therapeutic. And we also want to make sure that some of the conversation that we're going to be having here today may trigger you. And if you feel that that's the case, please feel free to step away and kind of compose yourself. You can come in and out of the meeting as you need to. We just want to make sure that you're taking care of yourself. So as we're getting started here today, I want to give you guys a little bit of additional context for those who might not be familiar with NAMI. NAMI is the National Alliance on Mental Illness. It is one of the largest grassroots mental health organizations. We provide advocacy, education, support, and public awareness so that individuals and families affected by mental illness can build and have better lives. NAMI San Francisco is one of hundreds of affiliates across the country that is working to help to end the stigma of mental health and support those who are in need. Our programs are presented by trained volunteers like myself who have personal experience or who are either living with a mental condition or caring for a loved one who has a mental condition. For all transparency, I live currently with anxiety and PTSD. NAMI was huge in helping me get the information, the education, and staying track to make sure that I was able to function and keep myself floating above. So I want to be transparent so you feel comfortable that you are in a good, clean space. This is a confidential space. Nothing will leave this area, and that you can share whatever you're comfortable sharing with. So without further ado, I want to get into introducing our panelists. Our first panelist is Dr. Jason Outlaw. Dr. Outlaw is a licensed psychologist and clinical director of Journey of Life Psychological Incorporated. Dr. Outlaw received his doctoral training at Arizona State University, where he researched academic identification and factors of academic persistence. He completed his pre-doctoral internship at Butler University and Behavioral Corp and his postdoctoral fellowship, clinical assessment, at University of Houston's Counseling and Psychological Services. Dr. Outlaw previously chaired the Alameda County Mental Health Board representing District 5 and was vice chair of the Alameda County Measure A Oversight Committee. I'd like to welcome Dr. Outlaw to the panel.
Thank you for having me. I appreciate that introduction.
Absolutely. Absolutely. Thank you for being here with us tonight. The second panelist is Ms. Ricka, also known as Ricka L White-Soso. She is a professional social worker in a private practice whose special interests are community health issues, including interpersonal violence, health disparities, health and wellness, foster and transitional age youth advocacy and public service. She has worked in the behavioral health and social services field for the past 30 years, showing a lifetime commitment to the betterment and health of her community. Ms. Ricka received her BA in psychology and master's in social work from San Francisco State University. She holds the following certifications: National Certified Art Therapist, Batterers Intervention Program Facilitator Certification, Domestic Violence Counselor Certification, Model Approach to Partnerships in Parenting Leader Certification, that is MAP, M-A-P-P, and Sexual Assault Advocate Certification. Ms. White-Soso is married and lives with her husband and fur baby in Oakland, California. Welcome, Ms. Ricka.
Thank you. Welcome. Thank you for that introduction.
Absolutely. So I want to just remind everyone, if you have questions, you can either chat them confidentially to me privately, and we're going to answer and come to the questions at the end of the program. Keep the conversation going. Chat, feel free to chat. We're going to have a variety of conversation that's going to be specifically for the Black community. And for those who have joined us who are not specifically a part of the Black community, welcome. We thank you. This is an opportunity where we get to understand and appreciate each other. We are not speaking for all of the Black community, as we are not a monolithic people. However, these two panelists are very experienced, have a wealth of knowledge, and is going to give you a lot of clear insight. So I received questions from individuals that had registered that were exciting. And then we also came up with topic matters. So I'm going to kind of go ahead and start it off. I'm going to start off with Dr. Outlaw. And so this question is kind of general, but I know you're going to kind of be able to narrow it down. We already said that we're not a monolithic people. We know that. We think different. We look different. We act different. But what are some common mental illnesses that Black Americans face on a daily basis that is specific to Black folks?
Yeah, no, that's a good question. And the honest reality is that much of what we experience or what we are diagnosed as is not very different than the general population as well. We do have some specific factors in the environment that contribute to our unique presentations, but we're not very different. And so we're talking depression, anxiety, the mood disorders. Bipolar disorder is another one that's related, kind of a mix between the two to kind of define that for lay people. But also adjustment disorders are very common in our community. And all an adjustment disorder really is there is an identifiable factor that is causing significant symptoms in the individual. That could be something as simple as you lost your job. That can be your relationship has ended. It could be anything. It doesn't have to be one specific sort of thing, but it has to cause clinically significant symptom presentation. So that happens a lot. Many of us at some point in our lives qualify for an adjustment disorder. But above and beyond that, I'd say partner relational problems, right? That's a very common one. Relationships are hard work. We all would agree that it's a part-time job at minimum. So anytime that we are experiencing significant relationship problems, that can have an impact on us in our day-to-day functioning. Also, parent-child relational problems, right? Like if we have children or we are mentoring a young person, certainly we all have gone through periods in which it was difficult. And we may think that we were losing our child or children, and this is going to cause a significant impact on us as well. Those are some common ones. And then the biggie that I think most people can kind of understand is substance abuse disorders, right? So substance abuse disorders many times are created as an effect of what we were dealing with prior to. And so we are attempting at times to mask negative emotion by using substances. And it's not always a purposeful sort of thing where your intent is to get really intoxicated. Sometimes it's just a nightcap, right? Or we use certain phrases to just describe just kind of winding down. And sometimes that can get out of hand. Certainly during the pandemic, we've seen higher incidences of substance usage rates, primarily because we're at home and you have an opportunity, if you want, to have a drink or a smoke or whatever the case may be in the middle of your day, as opposed to that not being socially acceptable in the workplace. So those are like the common ones. That doesn't mean that these are all of them, but these are the common ones. And within depression and anxiety and the mood disorders, we get some really specific ones, such as phobias and social anxieties and specific anxieties and so forth. But I did want to answer your question. Hopefully that can kind of start our conversation off today.
Absolutely, definitely. Ms. Ricka, did you want to piggyback in on that?
I just wanted to, Dr. Outlaw did a very good job in giving a great summary of everything. And what I really appreciate is Dr. saying that we're no different than other persons in a lot of ways, and that we are experiencing similar diagnoses like everyone else. It may look different, feel different, but it is the same. If you didn't have anxiety before the pandemic, you got some now, right? If you didn't have some depression and everything else, everything that went on during this time, and do keep in mind we are still in a pandemic. Don't get too comfortable. We are still in a pandemic, and so the experiencing of all the things that Dr. Outlaw shared is high for everyone. The incidences of substance abuse, I'm glad he mentioned it, has increased because what we can it's like it's just right there. I just go around right to the kitchen and get it right fast. They actually say, read something that said that there was like people, the wine company, or those companies that you can order your wine to come to your house, sales went up by like 200 something percent, because why? You can just get that drink right quick. It's nothing. So substance abuse in all levels, not just substances and alcohol, but actually also weed and meth and everything. Everything's in that, because people are using those things to manage their stress, anxiety, feelings of isolation, depression. And so I'm glad we're having this conversation tonight, and hopefully persons will be able to lead with some support around how to take care of themselves moving forward.
Excellent. Thank you for that. That kind of does a segue into another question that I have. So, we kind of hear all the time that what's common in the Black community is, diabetes, heart disease, things of that nature. So I just want to kind of, why is there so much distrust in the Black community from getting mental health? Because we know that there is a hesitation. It doesn't mean everyone, but there is still a hesitation for medicine. There's still a hesitation for mental health. Why is that? Why are we still struggling in 2021 to get that help? And Ms. Ricka, can I start with you?
Mm-hmm, that's fine. Let's see. Interestingly enough, I was thinking, I was at a conference this past weekend, virtually, of course. And there's some conversations about this very topic, basically. There was actually one specific doctor, Dr. Butler, who's actually the creator of the therapy cards. So that's a resource, therapy cards, if people want to get those to help support yourself around things and that. But she provided a kind of a historic overview of kind of really just going way back. When did talk therapy even start? It started in the 1940s, 1950s. And what was going on for Black people during that time? Segregation and things of that nature. It wasn't introduced to us as an option, as a thing for us to come and take part of. And even if it was, we were segregated, and wasn't many of us, not many of us now, but definitely not back in the 40s and 50s that were available to provide that type of support to our people. We did it differently. We didn't go to a therapy office. We went to our family or we went to the church. We probably get into that a little bit later. But I think part of why, first off, our foundation of treatment, medical treatment and mental health treatment, has been spotty and scary. We've been used to be what? I don't want to say guinea pigs, but we've been used to be experimented on, and like the Tuskegee airmen that had the situation there, and there's so many other things that we could talk about that are in our history. We haven't been listened to when we go to the doctor on a medical perspective and or mental health. And when we have been talking or sharing about our mental health woes or challenges, then we have been diagnosed with, sometimes misdiagnosed. They have idea of what we must be managing. And so we get under or over diagnosed, whether it be in medical treatment and or in mental health treatment. So if you are going to people who don't look like you and don't listen to you, have an idea already of what your problem is because they know it must be this because you're Black. Or don't offer you certain treatments because you're Black, because you're not going to follow up anyway. And I said, I'm just going to let you know. I worked in the hospital for 20 plus years. I sat down, had many conversations with doctors along with family members. And I hope I don't get in trouble, but some of the conversations were not consistent. We talked same diagnosis, maybe some little, some little things kind of tweaked a little different, but same diagnosis, one conversation with this family of a different ethnicity and different conversation over here. And I get in trouble. Doctor, I'm sorry. Why did you not offer that here? I remember having a situation where a doctor told me because that person's not going to follow up. That person was Black. And they were not going to, the idea was that they're not going to do all the stuff there. So I just give them like the simple. So when you go to the doctor, ask questions, ask questions, ask questions. Don't just accept what's presented to you. That's just a sidebar little nugget for you. But we are not trusting because it hasn't been a place to be and give our trust to. So we hope to have more people of color, but more specifically Black men and women to join into the medical field and the mental health field, and then not forget that they are also from us and keep our diagnosis, be true to us and our people.
Excellent. Thank you. Dr. Outlaw, did you want to piggyback on that?
Sure, I definitely do. And I think my response certainly underscores what Ms. Ricka said. And the medical community, although we are a part of it as mental health clinicians in some ways, historically has not done any justice to us in terms of equitable treatment, right? I think to take it one step further of what Ms. Ricka mentioned, I already tell all of my friends and family, if you want decent treatment, you have to advocate for your people. And that's just the reality of it. It's unfair. It sucks. It's not equity in any form or fashion. But if someone has a serious illness or even a not serious illness, and they just go and just accept what the doctor says initially, chances are that their treatment is not going to be the same. And that's basically what Ms. Ricka mentioned, is that she's seen it in practice, not just in theory. She's seen it in practice. And I've seen it as well. And for my own family, I go, and not necessarily to throw weight, but I go and let them know I'm a licensed clinician as well. And I will ask questions and I advocate for my people. And I've seen a difference when they can kind of tell that I'm in the medical field. And that's unfortunate, but that's the reality. Certainly the Tuskegee experiments is a huge one. People haven't forgotten. And whether you had a grandparent that was living at that time, or you read about it, or you saw a movie about it, the Tuskegee experiments lasted from 1932 to 1972. And these were sponsored by the U.S. Public Health Department and the CDC. So, we're not even going to talk about vaccines, and I'm a promoter of vaccines, but nonetheless, if we were to talk about mistrust in the system in terms of vaccines, the CDC was one of the sponsors of the Tuskegee experiments. And so we have all the reason in the world to mistrust the system. I tell even though I'm vaccinated and I promote the vaccine for reasons that I'm not going to go into today, but I tell everyone, look, you got to do what's best for you and your family. And if you feel as if you don't trust the system, maybe it's not the right time for you to do this. I'd hate to see people making a decision and somehow they get some illness that was triggered by it, and now they really mistrust the system. But those two events alone, or the modern day part of medicine, which we talked about, and the Tuskegee experiments, you take those two things alone, we are not irrational in our mistrust of the system, right? And you take it a step further, insurance companies. I accept every insurance underneath the sun, including Kaiser, including Cigna and Anthem Blue Cross, so forth and so on. But insurance companies are meant to make money, right? They're meant to take in your premiums and not pay out. And so in a perfect world, they take in 100 people's premiums and they pay out 2 or 3 people. That's how they make money. But there's inequity in that too, right? And so even if you take the fires in California, which have happened over the decades, you look at a place in which, and I'm talking broader insurance now, but you look at a place where Black neighborhood has been demolished by a fire or earthquake, and the reimbursement that's happened there, and you look at the reimbursement in the white area, there's some discrepancy. So guess what? We don't trust insurance people, period. And I'm not saying that to mean that like this is completely across the board and this is a vast generalization, but I'm saying we have reason behind this, right? And insurance is yet another one. Last but not least, African Americans, historically, we have tended to put our trust in the church, right? The church has been our sanctuary from our time in this country when we were enslaved. We were not slave, we were enslaved. I use that purposely to describe the difference between the two. When we were enslaved, we turned to each other and our own personal church services to survive and to gain some level of sanity. So if you look at where we are now, the church in the African-American community, arguably, doesn't have as much of an impact as maybe it did in the 40s, 50s, and 60s. So guess what? Who do we turn to? Not really sure if I should just handle this on my own. Not really sure if I should turn to my friends. Not really sure if I should, just do some self-care. I don't know really what to do. I think we're slowly but surely starting to break down some of the walls of stigma. Don't get me wrong, we got a long way to go, but I don't think that people are looking at mental health treatment as just for crazy people anymore. And let me just give a brief, I know my time's up here on this question, but let me give a brief history of why I feel stigma even started. If you really think about it, movies back in the 30s and 40s, they would show schizophrenics, people who were highly medicated, people who were impatient, and they barely had any control of themselves. And people saw that and they were scared out of their minds. So guess what? They then lumped everyone into that category and figured mental illness is that. I've seen it and I'm scared of it. I don't want anything to do with that. And we're slowly but surely coming around to broadening our understanding of what mental illness is. People who come into my clinic look just like all of us. There's not any difference. Someone could have gone through a divorce or a separation or a problem with their child. There's no such thing as one type of person who fits this kind of mental health sort of emblem. So I think all of those are the reasons why there is still some distrust or some mistrust in the medical community, in the mental health community, and it is up to us to reestablish that, to establish it and to start to build some trust. And hopefully in the near future, we will see a little bit more trust there. And of course, it does help to have culturally competent therapists and culturally competent physicians who understand our world. We don't have to explain that part to them. So with that being said, there's a lot of reason behind the mistrust, and hopefully we get beyond it in time.
I really appreciate when you said cultural competency. I think that's really the connector that will be able to really align. I, as a certified mental health advocate, have been asked why Black people do not seek out mental health. And as I tell them, I am not the representative for the Black race. But however, historically, there has been no benefit to it for us. So I appreciate, Dr. Outlaw, you breaking that down for us significantly. Definitely.
In addition to the fact that we're taught, right, to keep our business in the house.
We are.
We're not taught to talk to some strange person nowhere. In addition to the fact that I think sometimes there's a miseducation about what therapy is. We see therapists on the TV. There's a little lady, usually, or some man with a little pad, and they just sit there and they say, okay, our time is up. Time is up. Thank you so much. We'll get to see you next week. There's no, and people have different styles. Therapists have different styles. There's different licensure. There's different, and that is confusing as well. So the other part of it, it's hard to get to it, or we're not thinking about it. It's too hard to even figure out. It's just too much. And so what we do, a lot of times, we go back to what we talked about earlier. We soothe ourselves. We find ways to take care of ourselves in another way. And that might be hit the bottom, might be hit the, or whatever. It may be seeking other substances, but those ways are temporary bandages to the pain, hurt, trauma, and everything that we have been absorbing through our lives. So we're hoping that you consider seeking services in the future, whenever you need to.
And before we go into the next question, I wanted to just piggyback on a concept that we threw out there as well. And so stigma, I think it's kind of unique within the Black community, and I want to make sure we make a point of this. For whatever strange reason, and Ms. Ricka, I think you alluded to this just a moment ago, but for whatever strange reason, we've been conditioned as Black folks to think that we should be able to handle all of our problems on our own.
Yeah.
And if you cannot handle those problems, you are somehow weak or you are defected. And that's far from the truth. And I think a lot of times, and I have no idea exactly where the origin of this came from, but I think it's very, very real. And it's even more prevalent within males, right? Not just Black males, but within males. We want to be, you can take us on a trip and pre GPS, and we're gonna tell you how to get there. We don't want to follow no map. We got the solution. I remember driving here 15 years ago. I don't need any help. I'm gonna get there. So there's something about the male ego that's conditioned to feel as if we have all the answers and we can handle this. And that's part of the reason why stigma is there, because it means to a lot of people, if I haven't been able to handle this on my own, then there must be something wrong with me.
And let's not forget the superwoman syndrome that we Black women sometimes have to have as well, right? So we have the men's side, so I'm gonna talk about that woman side. And on that woman side, and I would say almost all women, we can handle everything. We take care of the kids, the husband, the job, the community issues and everything else, and sometimes neglect ourselves. And but we can dust off good, look nice, smell nice, like nothing's wrong with us. We're not stressed at all. And it's the stress instead, we're taking it all in, and the stress instead shows up how? Medically, physically, high blood pressure, we have stroke, high cholesterol, all those things. So I think we're tired of being superwoman. Black women have had to be, women in general, but Black women specifically, have had to put on our backs the family. That's a whole nother conversation, so I won't go totally there. But it's time to take those super capes off, the superwoman capes off, and get the support and help we need. And during COVID, again, I don't keep want to talk about this pandemic, but it is the truth. Prior to COVID, prior to the pandemic, every May we walk around giving green ribbons out, trying to tell people how important it is. And now we don't even have to tell people how important mental health is now. Now people are running. Our phones are ringing. Our emails are going so much that we can't sometimes even absorb it. That's why we need some more therapists to come into the field, because with so much to help and support people around. And as Dr. Outlaw said, these people are not looking like the people from the movies in the 40s and the 50s. They're looking like just like me, you, and everyone else. It's okay. So the other day, I wrote a piece the other day that said, it's okay to have a therapist. Black mental health matters. Black mental health matters. Christian, Muslim, Buddhist, everybody's mental health matters. We can't be fully whole and fully healed if we don't take care of our mind, body, and spirit.
Thank you so much. And I just want to say that I recently burned my cape and I watched it burn. So let's talk about another aspect of, just being Black in America. Let's just, briefly kind of break down social injustice, how that plays a psyche when, we turn on the news and we see something else. It may not even be anybody that we know, but it's heart-wrenching. It's another something to carry on our head. Economic disparities, that are playing a role in our day-to-day and how that's affecting us as a people. Can we discuss that, Dr. Outlaw? Can I start with you?
Sure. And I like that you took this item because it was kind of a segue, because the first question you asked about kind of what are the common presentations that we have, we could have gone into the causes at that point, but this is a good place for us to do this. So certainly environmental factors and the social injustice and the different things that we read about and see and hear about in the news every day, those have a huge impact on us. And let me just start with this. Discrimination is basically, you have to separate the definition of discrimination from racism or any other isms. Discrimination is a differential treatment of people based on a bias, right? So if you feel as if Mexican people or Asian people are lazy and that's your bias against them, and then you choose to not hire them or interview them as a result, that is discrimination. That's the actual behavior as a result of it. So I know that there's a lot of groups out there that are trying to convince us that racism doesn't exist and discrimination doesn't exist. And that's a selfish sort of act, to maintain their place. And so I can understand the reasoning behind it. But discrimination takes place with us on a day-to-day basis, right? Whether we're talking about being passed over for jobs, being paid less than our white counterparts, even when there is ample evidence of comparable education and experience. Redlining tactics in which home ownerships we're not able to buy in certain places. And so therefore, our economic financial backing is not as robust as that as other people. Substandard education, the injustice system, which many people call it, as opposed to the justice system. So within the broad concept of discrimination, it's not a new concept for us, right? We all understand that we experience all this on a day-to-day basis, and it has been happening to us since the beginning of our arrival in this country, and it persists. Have we made progress? Yes. Do we have some reason for optimism? Yes, arguably, but it's been happening and it's not anything new. The effect of the quote unquote system is another environmental factor that plays its role into our psyche. The education and prison pipeline, criminalizing young Black boys and girls at an early age for age-appropriate behaviors, the stressors of the system resulting in us using substances to avoid feeling negative emotion, all those pieces. The desensitization of witnessing Black people being killed online, resulting in a higher likelihood of violence against us by all people. These are all things that we have to deal with. We may not think about on a day-to-day basis, but it certainly is there. Learned helplessness. It's another concept that's very much related to what I'm talking about, but all learned helplessness really is individuals, we've tried so much. We've marched, we've lobbied, we've done all the different things that qualify as us stepping up and standing up to get something done, but the end result is still the same, right? So if you look at the justice system, which I referred to a moment ago, many people who unfortunately have to go through family court, many men feel as if no matter what they do, they're going to come out on the wrong end of the stick. And so why should I even try anymore? So I just wanted to just kind of give you guys a couple different things that are very much a part of our day-to-day, if you haven't thought about it, and understand that these all play a role into our general mental disposition, our general emotional sort of disposition. And some people have the tools and the resources to deal with it in ways that are healthy and helpful and qualify as self-care, and many of us don't. And the people who don't, and don't get me wrong, even if you do, that doesn't mean you're guaranteed to have some positive outcome. But certainly if you don't, you're more predisposed to experiencing what we call a cluster of symptoms, which then qualifies as a mental health diagnosis. And I just named a couple of them, right? This isn't a comprehensive sort of list. These are a couple of the societal sort of factors that kind of play a role into it. And just to kind of take it one step further, we as people, not just as Black people, we as people, when we endure significant and a long duration of stressors, we not only hide behind substances, but we also hide behind food, right? We also hide behind multiple relationships to feel good, right? We also hide behind the effect of our pseudo assimilation into American culture of African Americans by trying to keep up with the Joneses and buying these material things to try to make it seem as if we've been successful in this crazy world, right? All these things certainly play into an end result that tends to not be positive for us. The hope is that through time and through us continuing to fight, that we'll see some progress. But even right now, today, in many states around this country, they are overtly taking away our rights to vote. And I don't think they even care that we know that it's overt at this point in time. They're going to do what they need to do to try to keep a stronghold on policy. And if we know anything about all of what I'm talking about now, at the legislative level is where you really make change. I mean, certainly at the grassroots level, don't get me wrong. I want us all to do our grassroots work, but at the legislative level is where things really are changed. And so I'll defer to Ms. Ricka for the rest of this question, but certainly there's a lot going on in our world as African Americans that, once again, we're not irrational for feeling the way that we do. We just have to have some insight and some awareness, and hopefully that gives us a little bit of a step up in terms of how to deal with it.
Yeah, yeah, yeah. Dr. Outlaw did an awesome job on outlining that for us. I was thinking as I put in the chat, say that, Dr. Outlaw, because we definitely just getting up, leaving the house, having to be mindful of absolutely everything you do, you say, how you look. Get to work, same thing, almost worse. It depending on where you work, even depending on where you work, it's even more that you have to be cautious of. Did I say, oh, she might have thought I said that in a smart way. Got to be careful of this. We almost have to. I was encouraged once by a manager to change the tone of like not just what I said, but she gave me an example of how to sound, to change how I sounded. And I'm who I am, and I had to answer it. So you're actually telling me, you're really suggesting, and this is another Black woman, so it was not someone else that I would have expected. It was another Black manager basically told me, yes, I think if you just change, and then the voice she gave me, the suggestion of the voice was so not me. We should not have to not be ourselves. We should not have to straighten our hair and have blue contacts on, although I like wearing different color contacts. But that's not the point. The point is we shouldn't have to, though, to fit in. I do it for cosmetic stuff, but to do it to fit in, though, to try to look a certain way, to act a certain way, sound a certain way, we have to be mindful all the time. I noticed that even for, and I'm not a man, but I've noticed even with men in my family being told, because they're tall, and, that could look intimidating, that they must carry themselves in a way that is non-threatening. And I'm not saying we want them to present like they're threatening, but we really have to pay attention to everything. We can't just be who we are. So that's another very stressful. And think about it, it's like we have to go through this all day. So when we get home, we grab what we can. We're hoping that we learn some ways that are healthy ways to take care of ourselves. But it was a battle all day, literally. And if you haven't lived that life, you haven't had that experience, it's hard to explain and hard for you to even really get it. I know it sounds like, why did they do that? But if you were to live it, it's a hard thing. But there's hope and there's help out there, and there's ways that we can manage things in a healthy, sound way for us to have good wellness all around.
Tamuri, can I just say just a few more things on the
Definitely.
social injustice piece before we move forward? I had just a couple more points that I wanted to add in there, and above and beyond what Ms. Ricka mentioned. So social injustice, certainly law enforcement has been in the news, and in modern times, there's been a lot of discussion about whether we should reform the criminal justice element in this country, period. And one thing I just want to say is very interesting, and thank God, thank whoever your creator is for the creation of the cell phone. And let me tell you why. Because the cell phone, at one point in time, all the cell phone did was make calls. Then they added video game. Then they added in camera. Then they added in the video camera. And I don't think the powers that be that want to maintain control over people, I don't even just say this country, but control over people, I don't think that they realize that, oh, by putting a video camera in the hands of every young person over 12, 13 years old, we can now objectively capture what's happening in these police occurrences, right? So I can even remember early in my lifetime, police report would come out and it would say, well, the person, grabbed for a gun, or they moved in an aggressive sort of manner, or they did this, or they did that. And we have now been seeing for at least 5, 10 years now, over and over and over, what the police report says is not what we see. And a video camera is about as objective as you can get. I mean, attorneys, they do a good job at arguing all kind of stuff. And the common argument now is, well, you didn't see what happened before the video camera started. But nonetheless, it's very interesting now that in this world of social injustice, that we can see a lot of these, not all of them, we can see a lot of them with our very own eyes, and we can draw our own conclusions from that. And I think it's, we're starting to see a little bit with the Derek Chauvin case. That was probably the first time I've ever seen an entire police department say, no, what he did was not right. 9 times out of 10, the police unions, it doesn't matter if they killed a baby, the baby flinched, they can kill a baby and they're going to say, nope, our officer did everything by policy. So I don't know if this is turning the tides of things or not, but thank God for cell phones, right? The other piece that I wanted to mention, I think with this concept of social inequity over historically in this country, you got to really, this isn't even funny, but you got to think back to Emancipation Proclamation and what happened thereafter. The former slave owners were given reparations, right? We're talking reparations now. How do we make things a little bit more equal for the injustices that we were given in this country? But isn't that just crazy that the slaves weren't, the people who were enslaved previously weren't given reparations or any sort of, well, why don't you have this so you can get on your feet? It was the previous slave owners were given reparations. And so there are things that happen in this country that is very clear that it's pretty tough for us as a people to be able to find our way and kind of catch up. It's almost like a bad Monopoly game. You woke up and people got hotels and houses and you just sitting there with nothing. And every property you hit, you getting slapped down or barely having any money in your pocket. That is the analogy that I can give for our experience in this country. Last but not least, immigrants. They come to this country and the government gives them low interest loans to start a business. We don't have access to that. To this day, it can be someone like you and I, all of us on this call, and we can say, oh, we want to start a business. We go to the bank, and depending on your credit score and everything else, they may just say, we can't help you at all. And I'm not suggesting that every immigrant gets this, but I can say this with fact, that it's a lot easier to come from some European country or some other country and get a loan and start a business and get on your feet. In addition to that, imagine what that does to us in our community to see people of other ethnicities coming in, running businesses, and they can barely speak English. This isn't a knock on immigrants. I don't want to make it seem that way. But what I'm saying is that there are social reasons that are happening to this day that in essence keep us in our place. And you have to think about what that's going to do when people realize that. We aren't a stupid people. We talk about all these things within our communities. And so guess what? The learned helplessness, this unfair sort of tactic being placed against us on a day-to-day basis are barbershop, hair shop discussions and everywhere that we go. And we are trying to figure out what can we do about it. And there's no clear solution.
Thank you so much for that, Dr. Outlaw. Both of you guys made brilliant points. Wow, it's just mind-boggling. I hope everyone who's on this, this Zoom event tonight is really able to take in that information. This is not to be negative or anti anything. It's just, this is the situation that the Black community consistently lives with. These are day-to-day markers that we live with, and we still get up and smile, we function, we meet other cultures with smiles on our faces, we operate and we function. So we understand
Right.
that it helps for everyone else to understand so that we are able to continue cohesively, hopefully cohesively cohabitating together. So
Yeah.
definitely. Did you want to say something, Miss Ricka?
No. I was
Okay.
agreeing. I apologize. I should be on mute.
No, you're good. You're good. So I kind of want to segue. Ms. Ricka is a domestic violence counselor. Well, you have a domestic violence counselor certification. And Dr. Outlaw had mentioned earlier about how we were talking about the common mental illnesses. And of course, he brought up relationships and how these can plague as well. So I want to discuss, and I want to start off with Ms. Ricka about trauma, the toxicity of a relationship or domestic violence. I just wanted to briefly add that when I initially started off tonight, I listed that I live with anxiety and PTSD. Prior to my last marriage, I lived with nothing that I know of. But I married someone that I didn't know had a substance abuse problem. And I didn't know, and I don't think he knew, was struggling with bipolar disorder. So the gift I obtained from that was living with what I call my superpower, anxiety and PTSD. And I wanted to segue into relationships because especially Black women, we talked about that cape that I don't have no more, there's only ashes in the backyard. But we talked about that cape of staying in relationships that are toxic and the domestic violence. What does that do for us? I mean, how does that help further along the demise of our psyche? So Ms. Ricka, if I could pivot to you, that'd be great.
Yeah. You know, so we know that a toxic relationship is not good. We know that. We know that, and first off, we have to define what is a toxic relationship, right? And it might change, definition might be different depending on who you are. What you see as toxic and not okay, someone else might see something different. But we do know that toxic relationships or relationships where domestic violence is present is usually not a healthy thing. So domestic violence, of course, in general, we think of someone that's, they're being physically assaulted, abused, and has physical scars, and we can see it, and it's no question. But there's also toxic relationships that show domestic violence situations that are emotional abuse, which are the scars we don't see and that it can't easily be even recognized. Sometimes we don't even see it when we're in the relationship. It starts out with little things like, you don't gotta go see your mama this weekend. Stay with me. Oh, your friend Mary, you always used to be with her. Why don't you just stay? So keeping you, just himself. And a lot of us, we say, oh, he loved me, girl. He don't want me to go nowhere. He want me to be with him all the time. He's so nice. He loved me so much. Okay. And then it sometimes in advance as it rolls up, and it can go in different directions, but it can roll into some other things, other kinds of controlling behaviors, and controlling even what you spend money on, and telling you what you and so things usually kind of start light that seem kind of cool. You kind of question it, but but no, he loved me. That's why he do that. And let me be clear, it can go both ways, men and women. So I don't want to even don't want anyone to leave here thinking, Rick said that only men are perpetrators of or offenders of domestic violence. It can go both ways. And there is a movement of persons that believe that sometimes there's mutual combat in some of these relationships and situations. But we're speaking of the traditional domestic violence, toxic. Other things that make a relationship toxic can be not only physical abuse and emotional abuse, where they're talking about you and saying negative things, and they love you so much because they are with you, but now we are going to throw you in, run you through the ground and tell you how unattractive you are, and how you're not this, and you're not smart, and you're not this. And a lot of us, for whatever reason, it could be that we believe that if I just do right, he won't do this or she won't do that, and it'll get better. And we hope for change, and we hope that it's going to be different because our love is so powerful, it's going to change him or her. And unless the person or persons, because sometimes I said, remember I said sometimes mutual, recognizes that this is not healthy and we need to get some support and help around this. Whether it be, and a lot of times they have these they're exhibiting these behaviors, whether they be physically abusing someone or emotionally abusing someone or financially abusing someone or sexually abusing someone. A lot of times it's because of what they learned themselves, what was planted in them as young people, whether it be, and sometimes it's not that, it's either they witnessed it, right? Mom, dad situation, or mom and boyfriend, or dad and girlfriend, or whatever. They witnessed it as kids. And usually when kids were like, we don't never want to do that when we get bigger. I'm never going to do that to my, and sometimes we find ourselves doing the exact same thing, either being the assault, the offender or abuser, or being someone who accepts that behavior. And we almost excuse it as, again, as love, because he loved me so much. That's why I made him so, that's why he was so mad, and that's why he and so I have both the domestic violence advocate counselor certification and the batterers intervention facilitators. When people say, why do you do that? You're either going to be on the one side, you're going to be on the other side. And what I notice is, no, I think we need to know both sides. And that's because many times the relationship doesn't end, right? A lot of times the relationship continues for years before someone leaves or before something happens really bad. I see someone put in the chat, the power and control wheel explains the different kinds of abuses and power, and how the abuser or offender may exhibit power and control to keep you in this domestic violence under control and things of that nature. So thank you for sharing that, Cassandra. Appreciate that. The other thing that sometimes why someone might either be on the side of being survivor or be on the side of being offender is because of their own, let's say they were abandoned, a child that was abandoned, a child who was unloved, a child who suffered some type of trauma. Sometimes the way a person expresses their frustration, because they haven't learned the good words to say, because we don't have the words to communicate the frustration they feel, they lash out. They feel abandoned. You're about to leave me. And so they find themselves struggling with how to say, I'm hurt, I'm sad, I'm this, I'm that. And the only thing they ever saw, or the most of what they ever saw, was to be physically violent or verbally violent. Because baby, verbal is that tongue is sharp. And sometimes, as we say, the wounds of the physical can heal, but that those emotional abuses, that emotional stuff, although the physical is something you remember, that emotional can haunt you for years. It makes you sometimes it contributes to your low self-esteem. You're questioning whether or not you're good enough. Can I find somebody who's going to love me without having to show it to me in this way? Can love be without pain, whether it be physical, mental pain? So we have to tell ourselves we deserve better. We deserve better. We deserve better. And that no love should hurt, and no love should feel emotionally straining. You should not have to walk on eggshells. In addition to the power and control wheel, they talk about the cycle of violence, and how the cycle of violence is just that, a cycle. And that the more times you go around that circle, that cycle of violence, the faster it seems like you get to that explosion, that blow up situation, whether it be a physical, emotional abuse or whatnot. And the faster you do that, sometimes it also says, not only is it the faster it goes, the more abusive you get, those explosions get. You have that explosion, you have the, yes, oh honey, baby, I never do it again. I'm so sorry. I need to really get some help. I need to do something. And you say, okay. And you hang on that, walk around on eggshells, trying to just be okay until the next. I have seen so many domestic violence cases. And during this pandemic, of course, we know that domestic violence, in addition to substance abuse, in addition to suicide ideations, as soon as everything else, domestic violence went up as well. We ain't been in these houses with these people this long. In a long time. Our tempers are short. We don't have the patience, and we're drinking. So when we know that sometimes, not always, but domestic violence, sometimes when you look at the case, you talk to people, somebody was drinking, somebody was smoking. But actually, we both was sometimes, not always, but sometimes we both were, or this one were. But all that to say, but I've witnessed watching couples. So the reason why I got both certifications was because I noticed that couples weren't leaving each other. Not always, at least not initially. And so I was like, well, if they're not going to leave each other, I need to understand how to manage and help people understand how to manage their anger. And anger starts at frustration. People always wait to try to take care of themselves after they're at 10 of their anger. Like 0 to 10, they're like, at 10, I'm gonna try to hang out and take care of myself. No, it's when you got that little frustration feeling, you're kind of agitated. That's when you want to take a step back, a timeout, or something before we move forward. That's on both persons' end, I believe. If you take care of yourself and that person takes care of themselves, we could probably decrease some of these incidences of domestic violence in our homes, and whether it be physical or emotional. Although, of course, we always have the outliers. Don't matter what's said, what's being done, they just went off or whatnot. But I went and got both of those certifications in order to support. Let me be clear. Support in the way of education and training the person who is the offender and learning how to manage their anger, what other things they can do, especially those persons that. And so I used to teach those classes that 52 weeks of batterers intervention. I used to do those at the program, and watching people come in. She did it. She did it. She wouldn't have said that. She didn't do this. He didn't do this. She didn't do. And by the end of the time together, they realize that everybody's responsible for themselves. You are responsible. You are not responsible if someone has abused you. That is not your fault. They need to everyone needs to learn some better skills. Toxic. It does take a great taxing on our mental health. It makes us sometimes internalize things to the point where we became more anxious. And after being part of being a victim or survivor rather of domestic violence, then we have the aftermath of that. Sometimes that's flashbacks, right? Sometimes that's not sure. You think you seeing the person and everything else in between. So do seek support for that if you are experiencing anything like that. I watch cases evolve to. I've even had a case evolve to being fatal. Watching a couple come in the hospital over and over and over and over and over and over, and having to make the phone call to a mom to say, "Hey, I need you to come to the hospital about your son." Interestingly enough, this woman already knew what I was going to tell her when she got to the hospital. Actually, the doctor tells I'm there to manage the emotional outline. And before I could tell her, she just looked at before the doctor even said anything, the mom says, he killed her, huh? She knew that cycle is real. If you're able to disrupt the cycle, please do. Get support, get help, talk to someone, because it can definitely manage it. It can have lasting effects on your life and on your mind for years to come. And there's support out there.
Thank you, Ms. Ricka. Dr. Outlaw, did you want to jump in?
Yeah, I just have a few words. I mean, Ms. Ricka did a wonderful job at describing DV from both sides, and so I won't add too much to it. The only thing that I'll just say is that when we're looking at the impact or the long-term effect of DV, one thing we have to also keep in mind is that we are witnessing um, in that dynamic. We're witnessing the absence of effective problem solving skills. We're witnessing the absence of effective communication, right? And so they're starting from a point of lack of love, right? And lack of understanding, lack of patience, lack of many of the qualities that we want to see in relationships that tend to thrive. right? And so in addition to the power differential that's a part of domestic violence, they have a tough time, because even if you remove the behavior of DV, there's still a lot to be learned there. And so just want to kind of throw that out there. And I think a lot of times that that's not a surprise. Both people understand, like, wow, if I'm pissed off at something, the dynamic in this relationship is to throw things and to punch a hole in the wall. And it takes some conscious effort to shift the dynamic in those relationships. And many times, I won't say all the time, but many times it can also be a displacement of anger. It doesn't have to be violence on the part of an adult to another adult. Many times what's happening in our lives is so strenuous, so arduous, so difficult that something then triggers us to react in a way that clearly shows our frustration. And it may not even be about that person. It may be about what your boss said to you at work, or about, the bank, how they overdrew your account when you had money in it and they charge you an extra $400. Displaced anger is a real thing. And I think we all need to understand and be very cognizant when we become upset. As Ms. Ricka mentioned a moment ago, you got to take that time in the beginning. You got to catch it on the front end and ask yourself, is this about what this person did, or is this about something else? And sometimes that's a half-second sort of thought, and the answer to that sometimes can help.
Thank you so much for that. And I just wanted to clarify that that comment is not a Black community comment, of course. But I thought in the discussion that we're having about mental illness and different things that contribute to that, and you guys so eloquently gave wonderful examples, explanation, and things of that nature, resources behind that, that it was important to add that to the conversation, because of course, oftentimes we're heard less when we do complain. Those reports are not followed up in our community where they are in others. So I just wanted to list that that's not a Black person issue, that's a human issue, and it's affect us too. So fantastic. So I just wanted to remind everyone, if you have any comments, questions, I do have questions, to please put them in the chat. We have a little bit less than 30 minutes. This has been a fantastic conversation. I see the comments and the conversation going on in the chat, so I know everyone's enjoying it. So I wanted to ask another question before I kind of start segueing into questions that I received privately, because I think it's important for us to, we've kind of looked at what kind of triggers, if you will, can cause us to have to deal with, mental illness, the various different variations of that. But how can we, and you guys really would know this best, support our community, the Black community, to not only to acknowledge, but to recognize and to get the help that they need? And we're going to talk about resources a little bit later, but what are some recommendations that you guys have that can really get our community understanding and getting on the go with some mental health treatment, and why it's okay?
Yeah, I'll take that question first. And I think things like this are very helpful, right? And so as much as we have people who are live enjoying this discussion and dialogue at this point, there's going to be many people who are going to see this when the recording is posted thereafter. So just seeing people and hearing people talk about mental health is one way to reduce the general stigma. And the more we reduce stigma and the more we get to talking about May is Mental Health Month, and the more we get to sharing resources, the more we get to sharing, this is a therapy. I mean, I've seen online where people will just share people who own businesses. And I've seen therapists, businesses lumped in with people who own t-shirt businesses and so forth.
Mm-hmm.
So the more we normalize mental health, talking about mental health, I think that's going to be one of the biggest things that we can do. Now, Ms. Ricka may agree with me on this point. I'm a little afraid. And the reason why I'm afraid is because we already don't have enough therapists of color as it is. Right now, I probably have 15, 20 voicemail on my voicemail right now. And I see 5 or 6 clients a day. And I have a part-time admin assistant who checks the voicemail, but all she can do is check the voicemail, call them back, take their information, and put them on a wait list. So the reason why I'm scared or afraid is that we are already behind. We need to start graduating and cultivating the next class of therapists of all ethnicities and all religions, all genders, and
Yeah.
so forth. It's not just a Black thing,
Yeah.
but particularly in the Black community, we're already behind. And I've had some ideas where I've wanted to kind of hold like a quarterly career fair of just um, kind of healthcare providers, period, and just trying to get young people to see people who look like them to say, oh, maybe I can do that. I've thought about that. Of course, it takes a lot of planning, and the pandemic didn't help. But if we're talking about how to support our community, now is one issue, but I can imagine that if we fast forward 10 years down the line, if we don't have more people graduating who look like us, this problem is going to be even bigger. All they're going to do is catch voicemails and send emails. And Miss Ricka is just like me. We don't have a bunch of openings. So therefore, where do they go? They tend to find the next best thing, which might not hold cultural competence. No one wants to explain their experience in this country and explain kind of what they've had to go through. You want someone who knows what that thing is like. In addition to that, there are some therapists who will try to convince you that what you're experiencing is abnormal of some sort. That doesn't mean that that's going to happen each and everywhere you go, but it just goes to underscore the importance of cultural competence in our therapeutic clinicians and our therapeutic best practices, because that makes a huge difference when you feel like, you understand where I'm coming from. I don't feel like I'm alone in this. So to take it to the next level, above and beyond the things that I've already mentioned, I do think kind of sharing of resources is a huge important. It doesn't have to be a clinician sharing it. I like to share the website psychologytoday.com. That's really good because it doesn't matter where people live. You can filter your search for a therapist by zip code, by insurance, by presenting concern, and so forth. And so whenever people in other states are asking me, Dr. Outlaw, I need somebody in Texas or in Oklahoma, all I do is go to Psych Today and I type in what I'm looking for and I send them a link and I'll give them all the therapists they can call that phone number. I also like to promote the concept of books and literature, right? There's lots of books out there that not only are self-help books, but also explain our struggle in this country. And some of them are written in the 60s and 70s, and they're very much still relevant. One book that I like to promote all the time, especially for Black men, is a book by a psychologist named NAMI Akbar, and his book is called Visions for Black Men. He's also written Breaking the Chains of Psychological Slavery. We have lots of other books, post-traumatic slave disorder. The books are countless. And if you happen to pick up a book that interests you in some way, you might be able to share that book with someone else and help them in their situation, or you might just gain some insight. So there's many things that we can do, but I guess I'm hoping that everyone on this call and everyone who's going to be watching this recording who has some level of interest in mental health, that you just spread the word and just talk to other people, share links, and share different things that are relevant.
Excellent. Ms. Ricka?
Yeah. Yes, and making sure you keep in mind that mental health is important every day, not just in May, every month, every day, throughout the year is Mental Health Day, and that you have the right to have the support that you need, and that you have. I've heard a lot of people don't know. I think I saw someone in the chat say I don't have a problem getting a Black therapist. I always have one. Now though, I can't see them but every 2 to 3 weeks because they're so booked. And Dr. Outlaw talked to that. That yes, there are more out there. We just need to know how to find them. You need to know that if you have medical insurance, even if you have medical traditional commercial medical insurance, and if you have Medi-Cal, that mental health services are covered. That is a change that happened, I forgot how many years ago, but it is covered. Not only is it covered, you can ask for what you want. You do not have to just get the list and they give you 3, 4, whatever. You can say, I'm looking for and we know that there's other persons of color, maybe even on this call for this meeting right now. So you can ask for whatever it is you want. I want a Black woman with green hair who, whatever you want, you can ask for it. Now, it might not always be available. The person might be booked. The person, but ask and don't settle. If it's someone that you decide to go to, you can what's the word I want to say? just like I'm not saying shop for a therapist, but you're looking for someone to ride through a journey with you. And it's not a journey that's going to be, maybe it might not be, it may be a long journey. So you want to be comfortable with who you are having as your partner towards full healthier mental health um, space. You have that right, and it's nothing, no shade on any therapist, but just having a Black friend does not make you competent in being a Black, competent in Black, all things Black, and same as any other ethnicity. In any other ethnicity, you can't put any other ethnicity in the same thing. Just because you have a blank friend, that does not make you competent, culturally competent. So it's okay to ask questions. It's okay to talk with the person. Take the time to ask questions. Also, know that mental health and seeking mental health is self-care. And self-care is important. Self-care comes in all different ways, between, we'll talk about getting a mental health therapist, to taking an extra long bath and burn some candles, to something as simple as taking the time, instead of slapping that lotion on your feet like 2 seconds, rubbing your toes, taking your time and taking and feeling that beautiful feeling of, I'm just saying, self-care can be as simple or as complex as you want it to be. Dr. Outlaw talked a little bit about a couple of places that we can secure psychology today, and I think research, as he said, having forums like this, whether it be virtual, virtual, when you go get your hair done, the beautician says she's a therapist, but she can help you so far, and the barber can help you so far. Having those real conversations in small circles and larger circles, and make it be more, just like we say, go get an annual physical, or a physical when we have a pain, we say go ahead and get the pain taken care of. We want mental health to be just as regular that we just do. Our mind, and I think I said this on another place our minds are connected to this body. It's not separate. Our mind drives a lot of. If you are depressed, then you sometimes neglect your body, right? It's all connected. There's other places for Black therapists. If you don't, if your insurance tells you they don't give you lists like that, they should, but if they don't, there's also other websites that are available, like therapyforblackgirls.com, clinicianofcolor.com. If you want a therapist that's kind of social justice-y and mindful of those kinds of things, inclusivetherapist.com is a good one. If you're saying, oh, but I can't afford therapy and my insurance says they're not that much, and I don't know, but there's other things like foundations that are offering kind of like voucher program mental health services. And so one of those foundations is the BorisHensonFoundation.org. There's also the LovelandFoundation.org. And there's also freeblackTherapy.org. And those are foundations that either offer you a certain number of free sessions, if you can make sure you meet these different criteria, but that's another option that is available out there. And we talked about resources around books. Self-help books are hot, and they can be very helpful. Nothing wrong with but just keep in mind that's not therapy, but it is still helpful. And then there's other kinds of books. I wanted to just share a couple, if you don't mind. Is that okay? All right. Okay, so one is called The Unapologetic Guide to Black Mental Health. Navigate an unequal system, learn tools for emotional wellness, and get the help you deserve, by Rasheed Walker. There's another book called Black Mental Health Matters, The Ultimate Guide for Mental Health Awareness in the Black Community. And that has been written by Aaron Snyder. He's a licensed marriage family therapist. That one. There's another book. I love books, y'all. I love books. Y'all just don't know. I got shoes, but I got books. Probably more than that. Anyway, another book is called Black Fatigue: How Racism Erodes the Mind, Body, and Spirit by Mary Frances Winters. A good book. And last, there's so many books, but I only brought out 4 today. All right, last one is called Urban Trauma: A Legacy of Racism. And this is by Masai Akbar, Dr. Masai Akbar, I believe. Oh, you probably can't see it, but yeah. So just so read some things that support you. Also, your circle is important. Your circle is important. If your circle is toxic, you're gonna be absorbing some of that. So start, sometimes we gotta be selfish. We gotta be selfish about our self-care. And so maybe your circle needs to shrink a little bit for a little while to you evaluate some people, and you might have to put some people aside and all that to have that optimal wellness all around, mind, body, spirit.
Excellent, thank you. I wanted to go to some of the comments in the chat, which is really actually good advice. Interviewing therapists and be ready to explain what your goal is for therapy and what you hope to gain from them. You have to advocate for yourself. And sometimes you might not be on the same page, and it's okay to fire your therapist. If it's not connecting, I don't care what race they are, if it's not connecting, you don't feel like you guys are on the same wavelength, then you might have to find someone else and tell them, thanks so much for what you've done, but I'm moving forward. A couple of other comments that especially during this pandemic, all of the racism and everyday life, we need to take care of our mental health. We are all our brothers and sisters keepers. And then someone was kind enough to put additional resources: Association of Black Psychologists, excuse me, and Bay Area Black Social Workers, that they have listings of therapists of African descent. And then we had a nice comment that this discussion is very helpful to me. I'm not even in the Black community, but being a part of this inspires me to have similar conversations within my community. And then also a few additional. And then I listed some of the books there. So I'm very glad everyone is enjoying the conversation. Dr. Outlaw, did you want to add anything in before we get ready to go to the Q&A from the audience?
No, I think now is the time. We only got about 11 minutes left, so let's go ahead and jump into those questions.
Fantastic. Okay, so a couple of them were similar, and I think we kind of touched on this, but this is a little bit more specific. What are the unique barriers experienced by Black mental health patients versus their Caucasian peers with health insurance? And I know you touched on that, but maybe kind of more specific to that question.
Yeah, I say above and beyond what I already mentioned, what I've noticed is that a lot of times, and this I think is more socioeconomic status than it is Black, but people who don't have a bunch of money for health insurance, and they have a commercial plan, they tend to really not know what to really select. I think a lot of the times they select what is the cheapest monthly plan, but that cheapest monthly plan tends to come with huge deductibles and huge copays, right? And so I guess I just want to educate everyone to be well informed about the full capacity of what you're selecting, right? And so if you know that it's almost like car insurance, right? Like if you're just that type of person, don't never get into an accident, maybe you can pick the plan with the high deductible because you'll never get into a car accident. But if you know you get into car accidents, you may have to pay more every month, but you don't have to have a huge out-of-pocket sort of cost. So I guess I'm just encouraging everyone to be very mindful and ask questions and talk to people who accept insurance. It doesn't have to be a therapist. It can be any provider because they can give you some valid information. Many times I have to tell people like, look, this plan that you have, I did a pre-authorization and you have a $2,500 deductible, which means you have to pay out of pocket $2,500 before anything is paid out. And they're usually surprised by that. And so to answer your question, Tamuri, I would just say that people of color and people who are not well off financially tend to be able to benefit a little bit more if they are informed on the front end about an insurance plan that they're selecting. Sometimes it's like the first plan that they've ever purchased commercially out of pocket. And they're like, oh, I'm covered. and then they get hit with the reality in January about, oh, you chose this plan that's not good for you. So I just want to kind of add that part.
Excellent. Thank you. Excellent. Another question, what is the best way to reach this population? We already talked about things like this, where we're getting the information out and we're trying to reach in touch. But what else can we do as a community to really be able to kind of reach out specifically to our community about the importance? What might that look like?
So in addition to forums like this,
Yeah.
Well, there's a couple of things that's actually going on right now. I don't know how many of you've seen the NFL commercials around promoting mental health. You know, everybody watching football during the fall time, then that's the way. So that the people, different organizations are starting to do different things to really. So it's kind of like if your favorite football player is talking about mental health, then surely it must be good, right? There's stars that are now. So like the Boris Henson Foundation that I told you about to get a free voucher to have therapy for a little while. That is to what is that woman's name? Taraji Henson's dad. That's just named after her dad, but that's Taraji Henson's foundation. So my point is that any and every way we can. So we have flyers at church. We can have flyers at the Safeway, at the grocery outlet. I mean, we need to really and start having conversations in your families about that, because this is where a lot of our beliefs come from, right? From our families. So start having conversations with our families, with your children, or your children's children, grandbabies, or whoever. Just start us having these conversations, making it just like we could talk about high blood pressure and how you took a pill, and the high blood pressure. Just a simple. We talk about our diabetes. We got to take our insulin. We got to do this and got to do that. We got to make mental health just as regular in the conversation as every other condition that we are managing and challenges that we have.
Thank you so much, Ms. Ricka. Dr. Outlaw, did you have anything that you wanted to piggyback on?
Yeah, I think above and beyond what was already said, I think it's, and Ms. Ricka alluded to this a moment ago, but I think we need to really tap into our leaders. And so people who are already well respected, have a following, and somehow connect with them to spread the word, right? And so the same way that our NFL athletes and our stars are starting to kind of talk about it a bit, and they may or may not be getting paid for it, but nonetheless, it's still
Right.
reaching their followers. I think, reaching our church leaders, talking to our local politicians and just the different people, even if it's just merely putting out a public service announcement, that's helpful too. Me and Ms. Ricka talked about this offline a moment ago. I adopted a highway and it just says my name, but many people Google it. They're curious about what it is. So they Google it and they say, oh, well, I don't need mental health services, but my cousin does. And so there's like countless things that you can do. But I think the gist of it is, let's just bombard society with concepts of mental health and talk about it as much as we can. And I think that helps achieve our goal.
Excellent. Thank you so much. This was amazing. One thing we definitely want to do is make sure that we give you guys resources. Please make sure that you go back through the chat box to see the books that were recommended by Ms. Ricka, and then also some of the different organizations. If you're looking for a Black therapist or someone local to you, you can kind of get that resources. Andrew, could you please share screen some of our mental health resources? NAMI has a list of amazing resources that we have that we want to make sure you have access to. We have support groups the first Friday of every month, and that might change to twice a month. We have a Black Minds Matter. I'm actually the chair of that committee, so you'll have to see and talk to me. But we talk about a lot of different things and encourage each other and try to figure out how to make your day just a little bit better than it was when you came in. We have educational resources. One of the things that was really beneficial for me, understanding and being able to function, was getting the education I needed so I know how to move forward appropriately. Advocacy organizations, volunteer organizations. We can go to the next slide. NAMISF, definitely NAMI.org, or NAMISF, that's the San Francisco affiliate who I'm affiliated with. We have a lot of information. We have a hotline number, 415-237-0039. You can contact if you are feeling in crisis, contact us, or if it's urgent, call 911, of course. We have support groups for peers and family members, free educational classes, and we do public presentations. We do them for the workforce to encourage business owners and organizations to make sure that your employees feel comfortable sharing with you what they're dealing with, so that you have a much productive workplace and they feel comfortable doing so. So we do that, and we do different presentations where we talk about our own lived experiences, because that's how you break the stigma. When you talk about it, you're comfortable with talking. Yeah, I live with anxiety, but it's my superpower. It tells me when I've had enough of somebody and I'm not dealing with them anymore. But that's one of the many great things about that. So when you talk about it and you embrace it and you turn that around for yourself, then it doesn't become a burden. It then becomes something different. Also, we want to know if anyone's interested in hosting a presentation. NAMI is a magnificent organization. If you didn't know, now you know. We do a lot of presenting. We have a need for Black volunteers that are doing exactly what I do. I'm a professional public speaker, so I came out the womb talking. So I'm just letting you know I'm comfortable with it. But we do the training that helps us to be able to get into our community and encourage that need for resources and help and therapy. We don't push medication. We don't do anything of that nature. We just want you to know that there are resources and you have access to it. If you are interested in becoming a presenter, www.namisf.org, or you can email sally@namisf.org. If you guys or anyone is interested in being a part of the Black Mental Health Committee, I'm the chair of that committee, please put information in the chat. Give me your email address, telephone number. We'd love to have you ideas, how to spread the word, get the information out into our community. That's what it's all about. We have to get back to we're operating as a village, because that's when, you know, it's much more inclusive and about everyone. I really want to thank Dr. Outlaw. I knew you would be amazing. Miss Ricka White-Soso. I knew she was going to be fantastic. You guys, the chat is blowing up. They're super excited. They love the information, and you gave such meaningful presentations. So I want to thank you guys so much for that. I start on time, I end on time. If nothing else, that'll be on my headstone. Thank you so much, everyone. Have a good night, and thank you so much for joining us, everyone. Thank you. Good night.